Good morning and welcome to Sunday Today on this April 26th. I'm Willie Geist. This morning, parts of America are slowly beginning to reopen after weeks of being shut down by a global pandemic. Public health officials, including members of the White House task force, are warning about the risks of sending people out into the world too soon. So when is the right time? We'll get to that question in a moment. But first, the latest headlines. The coronavirus death toll in the U.S. has risen to more than 53,000, and the number of cases is inching closer to 1 million. There currently are close to 938,000 in this country. The World Health Organization caused some confusion on Saturday after reporting there is no evidence that people who had coronavirus would be immune from getting it again. That, of course, would be a major public health setback. The WHO later clarified a bit, saying it does believe people who are infected will develop some level of antibody protection, but it's too soon to know for sure. And during a webcast on Saturday, Dr. Anthony Fauci said the U.S. should be testing twice as many people as it is currently before we begin reopening the economy and society at large. Dr. Fauci says he believes that will happen in the next couple of weeks. But let's begin this morning with the first stages of reopening the country's economy. The state of Georgia has been out front in getting some of its citizens back to work. And that's where we find NBC's Sam Brock in Atlanta. Sam, good morning.
Willie, good morning. Georgia was already ahead of the curve when it comes to opening up salons, spas, and gyms within the last 48 hours. Now, restaurants and movie theaters slated to open tomorrow. But many owners are telling me, Willie, they're taking a wait-and-see approach.
For business owners waiting for weeks.
It's been horrible. I mean, I've had to close down.
A heavy lift is now over, with gyms like Cardin's Classic in Marietta, Georgia, back in business.
As soon as the governor did open things for us, God, I must have gotten 120 texts that day.
2 days after Governor Brian Kemp gave the thumbs up for tattoo parlors, nail salons, and spas to reopen, among other shops, we found plenty of closed doors and others reopening with adjustments.
I think from now, things are going to change.
The Brazilian beauty spa outside of Atlanta now requiring employees and customers to wear masks, paperless transactions, and constant sanitizing. It's a plan many states are trying to execute, with nearly 20 bringing back business in some way in the next week. South Carolina has already opened retail shops.
We are asking the customers to stay 6 feet away from each other and also our employees.
Tennessee will bring back restaurants at half capacity tomorrow. The flurry of activity coming as the World Health Organization warns there isn't enough evidence about COVID-19 antibodies to guarantee the accuracy of an immunity passport, the idea that infected people can't get sick again. Though later tweeting for clarification, most will develop an antibody response, providing some level of protection. An important reminder as even states which have been cautious, like California, allow some residents back on beaches.
I just don't think we have to live in a cave the whole time. We have to get out.
As everyone looks for something to be heartened by.
Sam Brock in Atlanta. Sam, thanks so much. I'm joined now by Dr. Richard Besser. He's the former acting director of the CDC, now the head of the Robert Wood Johnson Foundation. Dr. Besser, good morning. Thanks for your time. I appreciate it. I want to point out to our audience that you were acting CDC director during the 2009 H1N1 swine flu outbreak and held those daily briefings that we've become accustomed to at the White House. So let's start with Georgia and states that are now dipping their toes in the water and reopening parts of their economy. Obviously, you're coming at this from a medical point of view, but how do you find that balance? Because there are an awful lot of people who say, this isn't worth losing my business, my livelihood, putting food on the table to stay inside. How do you view that dilemma?
Yeah, I mean, Willie, it is a dilemma. Everyone wants to get back to work, and that's really important. But from a public health perspective, you want to do it slowly, carefully, based on the best public health science. And that requires a lot of data. You want to make sure that your cases have been going down for a couple of weeks. You want to make sure that you're able to test people adequately and know who's infected so you can get them isolated and get the people who've been in contact with them isolated. And overall, you want to make sure you have enough room in your hospitals because when you open the economy, there will be more cases. And if you are barely holding on in terms of treating COVID patients, think about all the people who have cancer and heart disease and diabetes who need medical care who haven't been getting it during this crisis. You need room for everybody.
You mentioned testing, Dr. Besser. It's become almost a cliche. People hear that. Testing, testing, testing. It's so important. Dr. Fauci underlined that again yesterday, saying we need to double our testing capacity before we can think about getting people back to work. Why, from your point of view, is testing so critical to reopening our society?
I mean, it's absolutely essential. And here's the reason why. Most people who get this infection, thankfully, are going to do very well. Right now, the healthcare is testing only those people with really severe illness to see if they need to be in the hospital if they have COVID. We have to be able to test people who have very mild symptoms, because while they're going to do well, they can continue to spread it. So you have to identify people with mild illness. You need to find out who they've been in contact with and identify those people. You have to provide space for these people so they can be isolated safely away from their loved ones so that no one else gets sick. But right now we're only testing sick, the most sick people. That's not what's going to make this work when we really open the economy.
And quickly, Dr. Besser, I want to ask you about that confusion from the WHO saying perhaps if you get coronavirus, you're not immune from it. You could get it again. They walk that back a little bit. But is it true that if you get coronavirus, there's a chance you are not immune from getting it a second time?
Well, it's an unanswered scientific question, and it has to be answered. Not only, whether antibodies mean you're immune, but is there a certain level of antibodies that means you're immune? If you're immune, does it mean you can't spread this to somebody else? The WHO said that there's no science to say that you're immune. That means the science hasn't been done yet, and it has to be done. And it's really important if we're going to use that as a card to get people back into work. We don't know that yet. And there's so many antibody tests out there. They haven't been validated yet to know that they're measuring the same thing and what all that information means.
All right, Dr. Richard Besser, former acting director of the CDC. Great to have your expertise this morning. Thanks so much for being with us.
Thank you, Willie.
Meanwhile, President Trump has no scheduled coronavirus task force briefing today. And for the first time in almost 2 weeks, he didn't hold one on Saturday either. The president taking the weekend off after he on Thursday wondered aloud at a briefing whether heat, light, or disinfectant might help get rid of coronavirus inside the body. In a tweet on Saturday, the president suggested he is not holding briefings because the media asks hostile questions, writing, "Not worth the time and effort." Chuck Todd is NBC's political director and moderator of Meet the Press. Chuck, good morning. Good to see you as always. Let's start right there with those briefings. The president, over the last few weeks, has enjoyed holding court for a couple of hours at a time in that briefing room. Some Republicans, according to a lot of reporting, are worried about the briefings, that they're not only hurting the president, but hurting the Republican Party as he goes out there, especially given what he said about disinfectants on Thursday. Will we see him in that briefing room again anytime soon?
Oh, I assume we do. I'm skeptical that this sort of him taking the advice of others saying, your presence there doesn't help. Whenever you tell him his presence doesn't help somewhere politically, not only does he not usually like to hear that, he will dig in his heels and say, "Oh yeah, watch me." So I think that this was one of the rare cases, and we've seen it, I'd say about once a year in Trump's life and politics. Do you see him turn tail, right, where he knows he needs to basically go into a corner and lick his wounds? And that is what it felt like. It's like he realized the incoming was that bad. He realized a break was necessary. But I'm very skeptical this is going to hold. Frankly, I would be shocked if by the end of the week he's back doing his multi-hour press conferences.
I totally agree. I was just going to say the same thing. I bet we see him again back this week after a little time away. Meanwhile, Chuck, there is a presidential campaign going on right now, believe it or not. Joe Biden is conducting his campaign from his home in Delaware. He said in an interview something a couple of days ago, quote, "I think," talking about President Trump, "he is going to try to kick back the election somehow, come up with some rationale why it can't be held." Joe Biden suggesting there may not be an election in November. Is that a widely viewed worry among Democrats?
No, I wouldn't say I've heard that widely viewed. I think that it is more of a "he wouldn't do that, would he?" type of question that you get, I think, from some on the left. I think this is one of those, this used to be attributed to LBJ, Willie. Sometimes you say things and you're like, I don't know if it's true or not. Make your opponent deny it. this had the whiff of what's the downside of the vice president saying it. It fires up the Democratic base, reminds them they need to show up and vote, and then it sort of force your opponent to say, oh, no, I'm not going to delay the election, which, of course, they'd like to get him on the record saying just that, Willie.
Strange presidential campaign indeed. Chuck Todd, thank you very much. As always, we, of course, will look for more this morning on Meet the Press when Chuck is joined by White House coronavirus coordinator, Dr. Deborah Birx. And as we head to break, our photo of the week. Members of the police department in Fort Myers, Florida, salute the doctors, nurses, and staff at the city's Lee Memorial Hospital by arranging their cruisers into the shape of a heart and turning on their red and blue lights. The officers holding up signs that read, FMPD thanks you.